adjust to these sounds. The hearing aid will sound better and better as you wear the hearing aids. So it's not going to sound as overwhelming as you did in the beginning because the brain will learn to adjust to all of these sounds. The next one, I can wear my friend's hearing aid. Now, we do have patients who come in and they have their friend's hearing aid or their brother's hearing aid or whatever, and they want to be able to wear these. So this is actually a fact. You can wear your friend's hearing aid. However, we do need to run real ear. We need to know your own unique hearing loss. And remember that ear canal acoustic is also going to be different from person to person. So combining that hearing loss, combining the ear canal acoustics will allow us to program that hearing aid, no matter how much it was programmed in previously, we could program it to your own personal hearing. Now, I want to make an analogy to shoes. So sometimes people come in just saying, I tried on my friend's hearing aid, it sounds bad, I don't like hearing aids. We would never look at our friend and the friend could say, you know what, I have these most comfortable shoes, I've been wearing them for 3 years, they fit me perfectly. And we wouldn't say, oh, okay, let me try them on. And we try them on and they are not comfortable, they're too tight on our toes, too loose on our heels. We wouldn't expect shoes to fit one person and then be uncomfortable for us. And that's kind of like with hearing aids. You wouldn't expect trying on someone else's hearing aids to sound good. Now, remember, we have to do real ear. So be careful if you just take someone's hearing aid and put them in your ears. If they have a lot more hearing loss than you can damage your ears because those hearing aids are going to be a lot louder than you need them. Or the opposite could happen. You can have a lot more hearing loss than your friend. You put the hearing aids on and you say, you know what, it's way too quiet. They're not benefiting me. I don't like hearing aids. So it's really important to use real ear so that we can adjust that hearing aid to your specific hearing loss. So moving on to the next one, hearing aids are not effective hearing protection. People ask us, do we need to take out our hearing aid if we are in loud noises? So it's a fact, they are not effective hearing protection. If you are in noisy situations, take out the hearing aids and plug up your ears. Even if you mute the hearing aid and keep the hearing aid in, it's still going to allow sound to pass through the hearing aid and the sounds will still be loud. Hearing aids are not designed to attenuate loud noise. So the sound will still leak through and it'll still be loud. Take them out and plug your ears. So you have earplugs and earmuffs that you can use to attenuate that sound. Don't use your hearing aid as a hearing protection device. The best way to protect your ears is double protection. What that is you have that earplug that you put into your ear canal. Usually it's that squishy part. You roll it up, put it in your ear canal, and then you can put headphones on top of your ear. So you have two hearing protection devices that can seal the canal the most and offer the most attenuation in those noisy situations. A lot of hunters use double protection because it's very loud sounds really close to their ears. All right, let's jump into the next fact or myth. Hearing aids are expensive. So I'm not going to say if this is a fact or a myth, but I do want to discuss the reasons behind the hearing aid price. Okay, so there are two different pricing structures to a hearing aid price. There are two models. There is a bundled approach and an unbundled approach. So the first one, the bundled approach, the cost of the hearing aid includes services with that clinic. So you're not just paying for the hearing aid, you're paying for services with that clinic, wherever you buy the hearing aid. The unbundled pricing only includes the hearing aid. So you would pay for the hearing aid, and if you want additional services, you would have to pay for everything. Anytime you come in, you would have to pay additional cost. Most clinics do follow the bundled pricing. So some of the services that go into the bundled pricing. The very first one is hearing aid fitting. So when you first come in, there are a number of hearing aids that you can purchase and try out. So we look at hearing aids together. We want to make sure that we have the best hearing aid for your goals. We make sure that the dome, the part that sits in your ear, fits the best. You have the correct strength of the hearing aid. Then we do those real ear measurements. Real ear measurements are not only completed during the first fitting, they can be completed following your hearing journey. So if we have any cause to believe like, hey, I don't think that the hearing aid is amplifying the way you should be, then we could do real ear measurements and verify that the hearing aid is working as it should be, or we need to, amplify some certain pitches to match your hearing loss a little bit better. Another thing is we always do hearing tests to make sure that your hearing is not changing. And if it is changing, again, we need to adjust that hearing aid for your new hearing loss. We do post-fitting validations, like questionnaires, asking how you're doing, touching base, make sure everything's going well. We do reprogramming based on your needs at certain times throughout the services. We do earwax removals. Of course, we take care of the hearing aid, any repairs, troubleshooting, cleanings. There's also accessories that we work with. And if we see that you struggle in certain environments, we will recommend accessories, we'll help you through that journey. And the most important one, I believe, is counseling. So when you just buy the hearing aid and not services, there's so much information with hearing aids, and it could be overwhelming just looking at the hearing aid. Where do you even begin? And so counseling is the biggest portion. We walk you through it, we answer any questions you have, and we're able to guide you through your journey too. So next, fact versus myth. I can wear any hearing aid dome. So dome is that squishy part that goes into your ear canal. That is a myth. So the dome that we choose, it's relative to your individual ear canal, and it's all about the acoustics in your ear canal. Remember, we put that probe in your ear and we make sure that we're amplifying to your own individual hearing loss, and the type of dome we put in the ear canal will change the acoustics of the hearing aid. It can make it louder or quieter, or we are able to reach certain targets. In general, if you decrease the size of the dome, it could provide a more comfortable fit. It could be easier to insert, but then a negative aspect could be feedback. Because the dome is not sealing the ear canal as well, you're going to have some sound that leaks out of your ear canal. Hearing aids will pick up that sound leakage, amplify it, and it's just going to be a loop over and over again. So that's why feedback occurs. That whistling that you hear, that's what's happening. So if you increase the dome size, you could reduce that feedback because you're effectively sealing the canal a little bit more. It could also help reduce itchiness because the dome isn't rubbing against your ear canal as much. But a negative could be you're going to have a lot more amplification in your ear because you're trapping the sound in your ear canal. So if you're already meeting targets and then we amplify more, it's going to be too loud, too boomy and echoey. Also, ear molds, it's another option. Ear molds is when we take an impression of your ear canal, and then the ear mold will be made to perfectly seal, perfectly fit in your own ear. So this will change the way environmental sounds, and of course your own voice is going to change because we're trapping in all of that sound. So we decide which dome would fit best based on hearing loss, but based on if it's comfortable. And changing the dome, we would have to relook at all of the targets and make sure that you're still meeting the target. Okay, next one. I don't need a hearing aid since I only have a mild hearing loss. So Myth. Even a mild hearing loss will have negative effects on cognitive abilities, work, home, and social life. There is also no guarantee that clarity will stay stable. So clarity is independent of hearing level. There has even been many studies that showed earlier hearing aid usage helps slow down that clarity deterioration. Now, I want to take a closer look at that audiogram there and see some of the sounds that you'll be missing with a mild hearing loss. So this orange box represents all of the sounds that you'll be missing even with a mild hearing loss. That gray banana bubble has all of the speech letters in the English language and the average of where they are laid on this graph. So anything in that orange box, it's going to be hard to hear those letters. You're going to be missing a lot of sounds, even with a mild hearing loss. So it's still a significant hearing loss when you compare it to speech. And as humans, that is the most important thing for us to hear is speech. So hearing aids will even help a mild hearing loss. Now, moving on. Hearing aids make my hearing worse in the long run because my ears become dependent on the hearing aid. I've heard this a couple times, and that is a myth. Hearing aids do not cause hearing loss. Hearing loss is caused by age, genetics, other environmental factors like noise exposure, medication even, and medical history. So hearing aids do not cause hearing loss. So you're not going to become dependent on that hearing aid. Hearing aids, like I said earlier adaptation of a hearing aid will actually strengthen your hearing. Hearing aids are strengthening your brain, and they may alter brain processing and decrease timing delays. Hearing aids may also strengthen your nerve, the nerve that connects your ear to your brain. So when we have hearing loss, our nerve is not working at 100% anymore. So to get that nerve to keep working as much as we can, we want to stimulate it with sound enrichment. And we do that by putting the hearing aid on and amplifying those soft sounds, amplifying those sounds that you haven't been hearing in a while. We want to force that nerve to keep working, keep it healthy, because it's sort of like a muscle. We've all heard the saying, if you don't use it, you lose it. And that's the same with that nerve. So if you have hearing loss, you want to put that hearing aid on and stimulate that nerve, because auditory deprivation, hearing loss, untreated hearing loss, can lead to poor speech clarity. And we don't want that. We want that nerve to be as strong as we can have it. Okay, now we're going to switch into talking about hearing loss myth and facts. And the first one is hearing loss can be prevented. Now that is a fact with a caveat. Of course, there are certain aspects that can be prevented, like limiting ototoxic medication. We can wear earplugs when we're around noise. That's going to help prevent hearing loss or further hearing loss. But there are, of course, some aspects that we cannot prevent, like genetics. Unfortunately, what your parents gave you, you have it. So if that's hearing loss gene, then that's going to be presented. Also, some certain diseases, they can have hearing loss with them. So those are some aspects that cannot be prevented. I do want to talk about hearing loss prevention in regards to noise. There are some groups of people that are affected by noise a little bit more than the average person. So these bullet points on the left here, they are exposed to a lot more noise on average. Musicians are an interesting one because not only are they exposed to a lot of noise, but their whole life is dependent on listening, hearing the people in their orchestra playing their part well. So it's very important to keep your ears very healthy so you can continue to do your life's work. How we are able to prevent noise-induced hearing loss, a couple things. Earplugs. Of course, wearing that earplug, double protection is best, will help reduce that noise exposure. But again, if you're a musician and your life depends on you hearing, then earplugs during practice may not be the most logical thing, but even limiting the amount of noise exposure can help, or taking breaks. That could give your ear a little bit of rest period and help prevent noise exposure. So our next fact versus myth, I'm sure a lot of you guys know the answer to this one. Fact versus myth, Q-tips are bad for our ears. Yes, unfortunately, that's a fact. So number one, Q-tips will push the wax further in your ear canal. A lot of times patients will say, well, you know, when I put the Q-tip in my ear canal, I do see wax on the end of it. I'm taking it out. But if you have a clump of wax in your ear, you won't be able to take that out with a Q-tip. You're going to take out a little bit from the sides, but the main chunk will be pushed further into your ear canal. And it's going to be even harder to take it out. Number two, using Q-tips can dry out your ear and cause itchiness. When you use a Q-tip, you're irritating your skin. The skin is very thin, very sensitive in your ear canal. So you're going to dry it out. And just by using Q-tips, it can cause itchiness in your ear canal. Also, earwax is very helpful in keeping out foreign objects. We want earwax there. We want earwax to prevent any foreign objects from going further in your ear canal and possibly damaging your eardrum. Earwax is also antibacterial. It's there for a reason, has good purpose being there. It's going to help protect against bacterial infections because it's antibacterial. If you do know that you have a lot of earwax, come see a professional so they could remove that excess earwax for you. All right, we're going to switch on over to Dr. Gale now.
All right. Thank you very much, Sophia. That was so great. I want to kind of mention that these myths and facts that you heard so far and what you are going to hear are common questions that we get from patients. So that's why we chose them for a reason. And also some of them are information that we think might be of interest to you guys. Okay. I'm going to talk a bit about hearing loss. Can hearing loss lead to increased risk of falls? Is it myth or fact? It's a fact. A lot of large-scale studies have shown that there is a strong association between hearing loss and increased fall risk. And why is that? Number one, when you have decreased hearing sensitivity, you have difficulty hearing sounds and soft sounds in the environment. And some of these sounds might be cues that alert you to potential hazardous and obstacles, such as, let's say, an object fall from the table to the floor and you cannot hear that. You might trip over that object and fall. So that could create a fall risk. Number two, hearing, we have two ears for a reason. The brain uses cues from two ears to help you locate where sound is coming from. So if you have, let's say, one ear that is worse than the other, and you don't treat that ear, that will affect the way your brain locate sounds. And that could lead to potential problems of navigating yourself in space. You might not know, where sound is coming from, and that might lead to potential risk for falling. Cognitive overload. This is a term that describes when the brain doesn't receive an input, a sensory input, it will put more burden or borrowing more resources from other parts of the brain. In this case, it could be your balance and your coordination. So decreased hearing will kind of put more load on other parts of the brain. So you have less resources to do those tasks. And this cognitive overload will come back, this term will come back when we talk about memory as well. Social engagement, we know that when you have hearing loss, a lot of people tend to withdraw from social situations. They are not engaging as much. And this could lead to reduced physical activity, right? Weaker muscle strength, and that could lead to poor balance and imbalance. Number 5, vestibular function. In our ear, in our inner ear, we not only have a hearing organ, but we also have a balance organ in each ear. And the balance and the hearing organs share the same structure, share the same fluid. So a lot of medical condition could cause you to have both hearing loss and balance problem. For example, if you have like a inner ear viral infection, the virus can travel to your inner ear and affect both hearing and balance organs. So this is how balance and hearing are associated. Okay. Let's go to the next myth and fact. Could untreated hearing loss become a risk factor for dementia? And this is a topic that a lot of people pay interest in because, it is important. We don't want to increase risk of dementia. And a lot of large-scale studies have shown that there is a correlation between hearing loss and dementia. They found that there is significant higher risk of dementia when you have untreated hearing loss. One of the biggest studies came out from Johns Hopkins University by Dr. Franklin, and they look at thousands and thousands of people, and that's what they found. And what could be the cause of this? Number 1 is physical brain changes. When you have hearing loss, there's actually a physical changes in your brain, both structural changes and functional changes in the brain, including atrophy in the areas associated with memory and cognition. So these changes could potentially increase the risk of developing dementia. Shared risk factors. Both hearing loss and dementia shared common risk factors, such as age. When we get older, we get age-related hearing loss, as well as developing the risk of dementia. Things like diabetes, cardiovascular or heart disease, hypertension, these are common risk factors that could contribute to both hearing loss and dementia and partially explain this association. Cognitive overload. Again, this term came up. Again, cognitive overload is when there is a decreased sensory input to the brain is trying to borrow more resources from other parts, other cognitive functions. In this case, it would be your memory. So you have less resources for a task involving memory. Okay, so that's cognitive overload. Social isolation, same thing. When you withdraw yourself from social activities because you have hearing loss, we know that social engagement is so important for your cognitive health. Think back when during the COVID pandemic, everyone was staying at home and there was a lot less social interactions. You remember how that have affected everyone's, not just you guys, but everyone's cognitive function. And the last thing is auditory deprivation. And Sophia mentioned about this already is, our nerves and our brain need consistent stimulation. If you don't use it, you lose it. So the nerves can become weaker when we have hearing loss, and this could affect other parts of the brain, such as your memory. Now, the question would be, would utilizing hearing aids consistently mitigate these effects and reduce the risk of dementia? And there is no consensus across the studies on this. So I think more research needs to be done. But a lot of research, including the studies by Dr. Lin, have shown that there is, when you use hearing aids as consistently, it shows that there's a lower risk of dementia, and it could slower the rates of cognitive decline over a long period of time. And remember that what we're talking about is a correlation effect and not a causation. It doesn't mean that because you have hearing loss, you are going to get dementia. Okay. We are talking about that there's a correlation between if you have hearing loss, there's an increased risk of dementia. There is an increased risk of falls because of untreated hearing loss. So if you have hearing loss or you suspect you may have hearing loss, it's a good idea to test your hearing and retest your hearing. And I would recommend if you have hearing loss, treat your hearing loss. So wear hearing aids, or it might not be hearing aids, it might be something else, but talk to your audiologist about it. All right, we're gonna switch gear to another myth and fact that involves family members or the loved ones of a person who has hearing loss. Now, this fact is for you. Does shouting at a person with a hearing impairment help them hear better? Is that myth or fact? It's a myth. I would say that louder doesn't always mean more clarity of speech. So shouting doesn't always make them hear better. Communication is two-way source. You know, we have a listener, but also the speaker is as important as the listener. Factors such as attention plays a big role. If the listener is not paying attention, let's say the listener is reading a book, watching a TV, and then you start talking to them, they might miss the first part of what you are saying because they're not paying attention. So maybe try to get their attention first, call their name before you start talking to them. Distance also plays a big role. Every 6 feet that you are away from the listener, about 50% of the volume drops. So it drops in half. So it's a lot softer if you're far away for the sound that the listener will hear. So if you're talking in a different room, talking from upstairs, don't expect that the listener will hear everything that you say. Face-to-face is also very important. When the person has hearing loss, they are going to use their eyes more to compensate for their hearing. So they're going to use their eyes to lip read, you know, watch your facial cues. And also face-to-face, when you talk face-to-face, the sound go directly to the listener and it's not bouncing around. So if you look the other way and talk, the sound has to go the other way first before it reaches the listener. So it's a good idea to look at each other when you talk. Protect your voice. This is very important. So the sound doesn't have to be loud, but if you project your voice will carry better to the listener, and that it will be a lot easier for them to hear you. And lower the background noise. We'll talk more a little bit about this in the next slide. If you try to talk to someone and there's a lot of noise, let's say the TV is on, the fan is on, people are talking, it's a lot harder for that person, for the listener to hear you. So maybe attempt to lower or turn off the TV or turn off the fan before you start talking. At our clinic, we have the speaker tips that we do give away for free for our patients. So if you need speaker tips to know what you can do to help the listener hear you better, you can always request this from us. So protect your voice. Someone asked me what protect your voice. So it just means that if I'm a speaker, consciously, I want to talk directly to you and make sure that you are hearing me. So instead of looking down at the table or covering my mouth and mumble, I try to project my voice to you. Does that make sense? Okay. Now, if you have trouble understanding speech or trouble with speech clarity, maybe try these tips. We talk about communication tips already. Self-advocacy is important. You as a person with hearing loss need to self-advocate. For example, let's say if you go to the restaurant, you could ask the waiter for a seat closer to the wall, away from the noise, away from the kitchen, so that you could hear better. if you're at work and you cannot hear, let's say, your client, maybe have a sign and say, I have a hearing loss, or work with your employer to get accommodations. There are also accessories that work with your hearing aids. For example, a remote microphone. A remote microphone is what the speaker, let's say your spouse, can use to help send their voice directly to the hearing aids. So let's say I have a hearing loss and then I go to a restaurant with my husband. I can give a remote microphone to my husband to wear, and his voice will come directly to my hearing aids and bypass all the background noise. So that's an accessory that a patient can get to work with a hearing aid. Are there assistive listening devices like a TV streamer? Again, that's a little accessory that you connect to the TV and it streams the sound from the TV directly to your ears. It helps you hear the TV clearer. Turn on closed captioning on the TV helps, using your eyes and your ears together can help you hear the TV better. Bluetooth Auracast. This device is not out in public yet, but in a couple years, in a year or 2 years, I think we'll see or learn more about Bluetooth Auracast. This is a system that will be available more in public space. Let's say your church, an auditorium, a movie theater, a musical theater. Hopefully we'll have this new system installed. It will connect with their sound system. And basically, if you have a hearing aid that has the same Bluetooth, a new Bluetooth low energy, it will pick up that sound directly in your ears. It is an exciting new development that we want to see available in public soon. If you have hearing, let's say you have problem with sound clarity, it is also a good idea to talk to your audiologist about the problem that you have to see if maybe your hearing aids are dirty, maybe they need to adjust your hearing aids to help you hear better. Wear your hearing aids consistently is also very important. Patients who wear hearing aids consistently do better than people who don't wear them consistently or wear them only as needed. And it's because we hear with our brain. When the brain hears the same sounds, let's say background noise over and over, the brain knows what to do with that sound. The brain will try to ignore that sound. So when you actually go into a situations where you need to hear speech better in the background noise, the brain does a better job at that. So if you wear the hearing aids consistently, you do a little bit better than people who don't. Cochlear implants. Hearing aids might not be the only option to treat your hearing loss. If your hearing is more severe, or if you have very, very poor understanding of speech, the audiologist would work with you and recommend you to maybe pursue a different option like a cochlear implant that may help improve a speech clarity. So in the social event or background noise, I think the most important factor that helps you hear better in background noise is to improve the ratio between speech, so in this case, how loud the speaker talks, and the background noise. So we want to have a good signal to noise ratio. Good signal to noise ratio will make it easier for you to hear. Every brain is different, so everyone performs differently in the background noise. Some brain does a better job at parse out the noise and focus on speech. Some brain doesn't do as a good job. But if we have a good signal to noise ratio, it will make it easier for you to hear in noise. And how do we do that? You either lower the noise down or you increase the speech up. So lower the noise down is, let's say in a restaurant, you want to find a better seating away from the noise. At home, you want to lower the TV volume down before you start talking to someone. Increase the volume of speech, so the speaker needs to speak up and maybe sitting closer to the listener. or things like remote microphone can help. And we talked about remote microphone. That's the device that the speaker can wear, and that their voice goes directly to the hearing aids and bypasses the background noise. And that will help improve signal to noise ratio. All right, now we're going to switch gear. We are going to talk a little bit about tinnitus or tinnitus. So what is tinnitus? Tinnitus is a perception of sound in your head or in your ears when there's no external sound. It could be described as ringing noise, buzzing, chirping, clicking, white noise, roaring, or even music. Some patients hear music play over and over. It could be in one ear or both ears, or it could just be described as in my head. Now, myth or fact, tinnitus is a sign of a major underlying problem or major underlying disease. I would say that's a myth most of the time. We don't know everything about tinnitus, but what we know about tinnitus based on studies is tinnitus comes from your brain. It's not coming from your ears. The brain, when there's a changes in the auditory system or any bodily functions, the brain will try to overcompensate and create this phantom perception of sound. In America, there are about 10 to 25% of adults who reported having tinnitus. And about 80% of those people have hearing loss. That means 20% don't have any hearing loss and have tinnitus. So there could be 200 possible causes of tinnitus, such as medications. You know, if you read the side effect, a lot of medication have a tinnitus listed as a side effect. Head trauma, you know, head injury or concussion can cause tinnitus. So even though you don't have hearing loss, you can still get tinnitus from head injury. Earwax, impacted rumen can cause tinnitus. Ear infections, noise exposure, that's probably the most common one, is exposure to loud noise would possibly cause tinnitus. Allergies, autoimmune disease, high blood pressure. There are so many causes of tinnitus. So it's not that there's something bad going on that causes tinnitus. And is there a cure for tinnitus? Right now, we do not have evidence that any of the treatments out there completely eliminate tinnitus. Completely eliminate it. So even though there's no universally recognized cure for tinnitus, there are treatment options that seem to work better than others. And one of the treatments that we are going to focus today involve two things. Basically, the therapy look at, instead of attacking or curing the tinnitus, it helps the patient manage their reactions to tinnitus and help them habituate to the tinnitus. And it involves two things. One is behavioral therapies. The patient needs to understand that the tinnitus is not harmful. So it begins educating the patient about the condition, understanding what tinnitus is, what may be the cause of the tinnitus and its mechanisms to help alleviate some of the fear and anxiety associated with tinnitus. Can you go back one slide, Sophia? And the reason for that is tinnitus reaction is a cycle. When you notice a tinnitus, the brain starts to react to it. If you don't know what that sound means, is it harmful to you, the brain will start to categorize it as a harmful sound and causes negative emotional response. So the limbic systems will start to react. So the brain thinks it's a threat, and then it will always try to look for that threat, okay? And then you're gonna hear it more. And so it's a vicious cycle that we try to break. So treatment for tinnitus is really try to break this cycle, and it can. So once the brain categorize the sound as something that you hear every day. It doesn't have any importance. The brain can, the subconscious part of the brain can stop detecting it. So you won't hear it anymore. And that's about 80% of patients who have tinnitus is they hear it all the time and they don't really, hear it anymore, or they don't get bothered by it. So that's where we want the patients to be. Cognitive behavioral therapy, this is the technique used by psychologists to change negative thought patterns. So in this case, negative thoughts related to tinnitus could be, I hear this ringing, would it ever go away? Or could I ever be functioning? Like, could I function with this ringing in my life? So cognitive behavioral therapy would aim to replace these thoughts with a more balanced and more positive, more realistic ones. Behavioral therapies also include relaxation exercises, and these exercises aim to reduce stress and physical responses to tinnitus. Because we know that when you're stressful, and especially if you cannot sleep, that will make tinnitus louder. So relaxation exercise could be, for example, deep breathing exercises, or mindfulness meditation, massages, or even any activities that help you relax. Activities that you could do before the tinnitus become bothersome. My patient, goes back to play golf, or they go, socialize with other people, they go out to the movies. That helps them relax and helps them focus less on tinnitus. The other important second component of tinnitus treatment is sound enrichment. So sound enrichment means we want to supply your brain back with sounds again to reduce that perception of the tinnitus. If you have hearing loss, we would recommend hearing aids. Hearing aids can help you hear soft sounds better in the environment, and it helps masking out the tinnitus that you have in your head. Other sound enrichment could be at night. You can turn on sound machines or sound generator to help you sleep better, and it could be even a sound generator app from your iPhone. If you play relaxing sounds like ocean noise or waterfall noise, anything that helps you relax, it helps you sleep better, and it helps masking out the tinnitus better. So those are two components, is education and sound enrichment. And this is the last slide. This is a good analogy between why we recommend hearing aids to help with tinnitus. So in a dark room, if you hear that sound in your brain is going to focus very much on that sound, similar to a dark room. And if you have one candle, you can see that one candle really, really well. But if you turn on the light in a room, or if you have more than one candle, more than one candles, you're not going to be able to find that same candle anymore. So similar to when you have tinnitus and when you wear hearing aids, you hear other sounds better. It helps masking out the tinnitus that you have, which I think is a great analogy. So those are some citations and references that we have. And we are going to end the presentation here. Now, this is your turn to ask questions. If you have any questions, just go ahead and unmute yourself or put them in the chat box.
A question I have about, I'm very fortunate. I live in the Bay Area and have been to the San Francisco office, but I have friends and family who live much farther away. How can they evaluate an honest, reliable place to get their hearing tested? My understanding is it's not a well-regulated industry.
Yes. It's hard for me to answer that, but I would say if probably the best place would be maybe a bigger hospital, a university hospital, or a clinic with audiologists, instead of a hearing aid dispensers who might not have as much education or background in this field.
Your hearing aids only guaranteed for 5 years, and after that 5 years is up, if I need service, then can I pay for additional service? Or do you just recommend that I get new hearing aids after 5 years?
So that's really up to you. And everywhere you go, it's going to be different. But at our clinic in Stockton, when you purchase the hearing aids, you get either 5 or 7 year service based on the plan that you got, based on the hearing aid level that you purchase. So after the 5 years, your option would be, if you want to continue to wear the hearing aids, you just pay for the service yearly. A yearly service to continue to receive the service here. But on average, people here at this clinic change their hearing aids about 5 to 7 years. So if you want to try new technology, you know, let's say something new come out that you really want to try, you can also try the hearing aids at that time. So 5 years is a good time.
So the primary reason then is because technology improves?
It would be technology improve, or your hearing aids are old and they're, you know, not working as well. And instead of paying to repair them, some people would just say, okay, I want to try new technology.
I have single-sided deafness. About 30 years, I have lost my hearing in my right ear. And a few months ago, I started losing my hearing in my left ear. So they've been giving me steroid injections, and I've had lots of ringing and echoing and muffling in my ears and everything. So is that prednisone maybe one of the medications that increases the tinnitus? And then I have another question about, what's happening is music now is starting to be really strange. I mean, it's echoing, it's muffling, it's really hard to listen to. So I'm wondering if I should play music perhaps so that my brain will adjust to it, or you know, maybe something at home where it's a low volume and maybe more soothing. I'm having a real difficulty even being able to tolerate the sound of music.
Yeah, I think I would recommend you, about prednisone, I would recommend you to talk to your doctor about it. But prednisone is commonly used when the patient has sudden sensory neural hearing loss to reduce inflammation, to help recover the hearing.
Right.
So that's what the ENT prescribe. So I would ask your doctor if this, you know, why would I get tinnitus after the prednisone? You know, you might have tinnitus already, you know, and when you have decreased hearing, then you're just hearing the tinnitus louder. So it might not be caused by prednisone, but it could just be caused by the condition of the hearing loss itself. And then I would definitely recommend a hearing test, you know, go in to talk to one of the audiologists in San Francisco. And based on the hearing test, they can tell so much about what could be the cause or what to do to help you with the symptoms that you have.
No, I had a couple of questions about, one of them is for cleaning the hearing aids. I do have a lot of earwax, and I clean my hearing aids every day, but you know, with the solution that you guys provide. And as far as my ears, I mean, I don't use Q-tips, but I kind of, with some toilet paper, actually, I do spray some of that solution on and then kind of get in there and clean. And of course, when I wash my hair, I clean them out really good. But anyway, it's kind of a daily thing because I do have a lot of wax. And then I have that special mold for one of my ears. And I just use, you know, I have a brush, a clean brush thing that I use the bristles, one of the bristles, to clean inside that. So I just was making sure, am I cleaning them too much? Or, you know, I mean, I'm assuming it's necessary to do that every day, clean them every day like that.
Sophia, you want to answer that question?
Yeah, so cleaning the hearing aids every day is not a bad thing, but with your ears, as long as you're not putting anything smaller in the ear canal, you should be okay. If you're just wiping the very entrance of the ear canal with the tissue, you should be fine. Don't push anything in there, and that's okay.
Oh, okay. I'm glad you said that because I really get it with the, you know, with anyway, okay, so.
Yeah,
I'm-
because our skin grows from the eardrum out, and it's able to take the wax closer to the entrance. So if you're just taking the tissue and wiping the outside portion, that's fine, that's good. But
Okay.
when the reason Q-tips are bad is because you push it in
Right.
your ear canal and it pushes all that wax with it. But if it's just the outside portion, you're okay.
Okay, oh, thank you very much. You know, one other thing, I was wondering, you know, that Bluetooth, AutoCast that you guys spoke of, I know I don't know if it's the same one, but they do have that. I know, like, for example, at Stockton Civic Theater, and I imagine a number of other places do have that, because my dad had hearing loss and he had one of those special devices like that, and he went to the theater. So if anybody's interested or whatever, it was really handy. So anyway, that's it for me.
Well, thank you, Jeannie. Yes, I think what he has is not Bluetooth AuraCast. It's just maybe a device that picks up a Bluetooth, or actually in Stockton Civic Theater, we helped them install a telecoil loop, which is an older technology. It's a loop that sends electromagnetic signals from their sound system to the hearing aids that has telecoil.
Oh, okay.
Bluetooth AuraCast is basically replacing telecoil. Telecoil loop is very expensive to install. You know, you're talking about $5,000 to install. So not a lot of places will have money to install that. The Bluetooth AuraCast is gonna be a lot cheaper, a lot more accessible for public places like airports even. So when you have hearing aids or devices that have Bluetooth AuraCast or Bluetooth low energy, we call, it will pick up the sounds from the system once you know, go to that program or something like that. So we don't know because it hasn't come out yet, but we are looking forward to that.
Wonderful. Thank you.
You're welcome.
Yeah, it says maybe 4 or 5 years ago, I read about the successful use of stem cell implants into the inner ear to improve hearing. What is the latest progress on this?
I'm not sure because I'm not, like, you know, when we go to conferences, big conferences, they talk about using stem cells therapy as one of the therapy. They don't have a successful result yet. Especially right now, they're not doing it in humans, they're doing it in animals. So there is no kind of studies that show that we could regenerate the hair cells with stem cells yet. But once we know, you know, that's why we go to conference all the time. And once we hear something break through, definitely that's something, that's gonna be out in public even before we telling you about it. But we'll let you guys know though.
I have one more question on the single-sided deafness thing. Now, on the 1 ear, I do wear hearing aids, and I'm in the good ear, which is now losing hearing in it. I have a hearing aid, and on the ear that had no hearing, it's a transmitter. I think that's still the same, the only device that's still available for my situation. But I guess nothing is being simulated in that 1 ear, and I don't know that there's any reason to try to. Or
actually, so what you're wearing is called Bicross. You're wearing a microphone transmitter, yeah. And you're right, it's not stimulating that ear, so you're still not getting a lot of binaural benefits from having 2 ears. The best treatment for you would be actually a cochlear implant on that dead ear. I don't know if they talked to you about it.
We have talked about it a little bit, but I didn't know whether, and I was told that if I do lose all the hearing in my left ear, definitely cochlear implants is an option. But I didn't know of having a cochlear implant already on the ear that has lost hearing is more distracting than just waiting.
No, I don't think so. I think no, it's case by case basis, but having a cochlear on that ear will help you hear sounds again on that side, and then you still wear a hearing aid on the other side. So then you get a binaural benefit of having 2 ears again.
Okay.
And that's
Would-
will help you
yeah.
hear better.
And would it help me to localize the sound too?
Better.
Can you explain a little bit how that would work, the cochlear implant? Because that sounds intriguing.
Yeah, a cochlear implant is a surgical procedure that the surgeon implant an internal device, electrical wire inside your hearing organ in your ear. So bypasses the damaged hair cells in the cochlear and stimulating the hearing nerves directly. So that's how it sends the sound directly to the ears and bypass the damaged cells. You're gonna wear what looks like a hearing aid on the outside, and it has a coil that communicates with the internal implant. So without the external sound processor, no one will know that you have an implant. It will just look like you have nothing. So when you wear the signal processor on the outside, then you start to hear. Yeah, and usually patients wear an implant on one side, a hearing aid on the other, or implant on both sides.
Thank you.
I have a question. If the nerve itself is damaged or destroyed, is there anything that can restore some hearing or some function to that? Or would you use the bicross or?
I would say cochlear implant, it
Really?
depends. So, yeah, so, as long as you have some nerves functions, the cochlear implant can help. When we talk about candidacy for cochlear implant, you have to wear hearing aid first, and you have to show that you get limited benefits from hearing aids, meaning even though you wear hearing aids, you're not getting any clarity. Then you might be a cochlear implant candidate. And that will help, even though the nerves are weaker, it will still gonna help. But if you don't have any nerves at all, let's say you have a tumor or you don't have any nerves at all, then
I have an acoustic neuroma.
Neuroma. So that's a different case.
Yeah.
I would talk to your ENT about that if you would be a candidate for a cochlear implant.
Thanks.
You're welcome.
Can I ask a question about the hearing aids that go completely in your ear versus the ones that go over the top of the ear? Are they better? And do they help you hear better?
Good question.
Yes, good question. So when we talk about differences in hearing aids, it really depends on your hearing loss. So if you have some normal hearing in the low pitches, let's say, we do not want to block your ear canal, because remember, that's going to trap a lot of that sound in your ear canal. When you're putting a hearing aid that is completely in the canal, you're going to be blocking that sound. And if you have normal pitches, it's going to sound very different. It might sound weird and too boomy. So we wouldn't recommend that type of hearing aid if your hearing loss doesn't allow for it. Most of the time, if you have some normal pitches, we would recommend the one over the ear because it will allow a little bit more natural airflow. You're still going to be able to hear the sounds around you and where you have those normal pitches, but then that hearing aid will be helping you where you have the hearing loss. So you really do have to look at your hearing loss and see what hearing aid works best for you. If you do have mild, moderate, like a moderate hearing loss in those low pitches, putting in that small hearing aid in your ear canal, that can help you, and that could help aid those low pitches when you need it to be. So it really depends on the hearing loss.
So if I wear my hearing aids all the time and have been wearing them for 6 years, but I seem to be losing clarity sound. So would that help with the clarity?
Not necessarily. So clarity is independent of, so when we do the hearing test, right, we test the beeps, which tell us the quietest you can hear. And then we also do some speech testing when you have to repeat some words. So that's two different things that we're testing. The beeps, they can stay the same and speech clarity could decrease, even though the beeps are the same. So they really are independent of one another. If the beeps stay the same, amplifying the beeps, amplifying speech is not gonna change that if clarity is still decreasing. So that's a little bit different, but I would recommend going back and doing a hearing test and see what's going on there with that clarity, and seeing if the audiogram changed.
So the clarity is a different issue then,
Yes,
just hearing. So, can hearing aids, different hearing aids or better hearing aids help with the clarity?
it depends what hearing aids you have and which hearing aids you're looking to. So it really is, we do need to know a lot more to be able to say yes or no.
Okay.
Dr. Gale, did you want to add something?
Yeah, so the clarity could be high frequencies also. When you have high frequency hearing loss, like a lot of you, when we get older, we start losing the high frequency hearing first. So that's why you start losing the clarity of sounds, because you're not hearing high frequency speech sounds like the S, the T, the P, the K, the F. So not hearing these sounds will reduce the clarity of speech as well. If you're asking about the two, which style is the best for the clarity, I would say, as long as we run real ear measurement and we program them about the same, getting the high frequency up, you can reach clarity for either style.
Okay.
What Sophia was mentioning, if you have, the exception is if you have good hearing in the low frequency, which a lot of you have because it's sloping. That means the low frequency is pretty normal. Plucking up your ear with a custom hearing aid that goes in the ear could lead to occlusion effect. Occlusion is like, you hear your voice booming, reverberating in your head more. So that's why we don't recommend the in the ear style with someone who has good hearing in the low pitch. But for the high pitch, both of them are going to be the same. So we really need to talk to, the style, the selection. It depends on the degree of the hearing loss, the type of the hearing loss. Dexterity plays a big role. If you have poor dexterity, maybe we choose one style over the other. If you have vision impairment, we're gonna put that into consideration. Things like if you want rechargeable battery or not, if you want Bluetooth or not, that plays in a role on what style we pick.
Okay.
Does that make sense? Yeah.
Yes. Thank you.
A lot of my friends have gotten hearing aids, but they go to places like Costco because of the price. And so I wonder if you could address the difference between hearing aids that you might have, which are probably more expensive than the Costco brands, and what the advantages or disadvantages are of that.
Sophia, you want to talk, or I can talk?
Yeah, so they are different. They're also different hearing aids. The thing with Costco is that usually there is not an audiologist present. So you're paying for the services as well, right? So you're paying for the hearing aid, which is also a different hearing aid, and you're paying for the person, the knowledge that they have, which most of the time is not an audiologist. Also here, Costco will lock their hearing aids, and you can only go to other Costco's to do anything with hearing aids. If you come to us with, Costco hearing aid, we can't do anything. So there are a couple of different factors when it comes to Costco. It will be cheaper, but then it's not going to be an audiologist helping you. The hearing aid is also different. And honestly, the biggest thing that makes a hearing aid good is knowing how to program a hearing aid, making sure that it is programmed for you, making sure that all of that, your needs and concerns are matching with the programming of the hearing aid. And so that is a very big important thing, to make sure that the person is programmed them correctly.
When you go to University of the Pacific, are you assigned to one audiologist? I'm currently being treated at UCSF for this additional hearing loss. And each time I've gone in for an audiogram, whoever's available, I go to. it's like they just assign me to whoever is available the first. And I'm just wondering how that works. Should you try to be with the same audiologist, or it really doesn't matter? And are there a lot of audiologists at each location at the University of the Pacific?
In San Francisco, the clinic director and one other audiologist are there full time. So you can always request. I would say they're not here, but I think you can try to request the same audiologist, because there are only two that are there pretty much every day. And in Stockton is the same way. I am here every day, and we have Dr. Awad, who is on a maternity leave, but the patient can request either one of us. But when you're talking about UCSF, it might be different because that's a hospital. Yeah.
Can I say something about Costco hearing aids?
Yeah. Mhm.
I bought my hearing aids at UOP 6 years ago, and I know I need new hearing aids. And so I have friends that bought their hearing aids at Costco, and I thought, wow, $1,600, I'll go buy them at Costco. And the people are very nice, but you're right, they don't have an audiologist. They're very busy. Every time I have a problem, since I bought them, I'm trying to get them adjusted. I can't get in for 3 weeks. At UOP, you can drop in and get these things taken care of, or you can get an appointment a lot quicker than 3 weeks. So it made me realize how valuable the service is. I mean, it's a shame that I have to pay that much, but I really think the service is worth the money.
Well, thank you. Thank you for that. Yeah, I think for me, a lot of people who comes from Costco, they're looking for not just buying a hearing aid here. They're looking for someone that can take care of them, guide them and pick the best hearing aids for them, and really help them maintain their hearing aids and be a like a counselor for their hearing loss throughout their journey.
Right.
All right. I will end the presentation here. So thank you very much for everyone who have come out today, and have a good day.
So much.
Thank you.
Bye.
Dr. Gail, Sophia, thanks so much for the information. I'll be there in a couple of weeks to see you.
Thank you.